Hello viewers of Dr. Tuteja Talk show. Today we welcome Dr. B. Lakshmi Shanti from Coimbatore, India. She is going to update us on rising trend of body image issue in teenagers, young adults, and in the society itself. Human body is a almighty God gift. So why should be there an issue in the creation of God? And why we should be worried about what the God has gifted us, the soul and the body. It was minimally in my era also. But today, now it is being seen as a trend of body image among teenagers through social media, Bollywood, and Hollywood. All are after the body image. It is conscience of it is in the conscience of teenagers and young adults, which is creating issue in day-to-day life. Let us know from our esteemed faculty, Dr. B. Shanti, about this issue in detail. I will like to introduce her. Dr. Tuteja Talk Show. B. Lakshmi Shanti. She is DCH PGDAP Consultant Child and Adolescent Health Specialist from Coimbatore, President IAP Coimbatore Branch, practicing child and adolescent pediatrics in Coimbatore from past 18 years and medical officer in Coimbatore Corporation Services. Active member of Coimbatore IIP AHA and IMA. Held various posts in district and state IIP AHA. Part of various modules in Adult Health Academy like Mission Kishore Uday, AYA, MSU and PSP. Publication in STG book, IIP book on adolescent friendly pediatric practice. IIP textbook of adolescent medicine, coffee table book, AHA, speaker in state and national conference. I may remind you, Dr. B. Lakshmi was one of the great associate, helper and faculty in Mission School Uday in few years ago. Our aim of Dr. Tuteja Talk Show is to update society, teenagers, young adults, and to bring the new faculties, young faculties in the limelight of the society, in the medical field and in the public. If you like, subscribe our channel. Your suggestion, comments are always welcome. I welcome Dr. B. Shanti to start our slideshow and so that we can proceed further.
Hello, sir. So my greetings from the city of Coimbatore, dear Tuteja sir, and all the viewers and subscribers of the Tuteja Talk Show channel. At the outset, I would like to appreciate you, sir, for starting this talk show and connecting with the public and dissemination of knowledge to the society and community at large at this and sharing your experience, especially of all your pediatric and adolescent health experience with the public, because media and social media has become a very indispensable part of our lives. And I earnestly appreciate that you have taken this route to connect to the media, sir. My heartfelt appreciations. And I still remember the time when you brought me into the adolescent health stage through the mission school Uday, and the opportunities that were provided by you for doing as a speaker in the mission school Uday. I still recollect with gratitude, sir. Thank you so much, sir. And both of us being adolescent torch bearers, it is very apt that this topic that we chose today, that is the body image in adolescence, will be very, like, it should connect with the viewers and it will give an insight into what the issues are. Thank you so much, sir. It's my privilege to host, to be in this talk show with you, sir. Thank you so much. Shall I share my screen, sir?
Yes, it is prestige to invite you, and we are happy to welcome you here on this talk.
So before starting or going on with the discussion, I just wanted to share a disclaimer, sir. So this talk show is aimed at creating awareness on body image disorders in adolescents to healthcare providers. And I just wanted to say that this doesn't cover or the entire depth of what we call the body dysmorphic disorder, which is a huge topic on its own. And this talk show will not cover the depth of that problem, which is a psychiatric disorder. This is just a healthy discussion on why today's adolescents are grappling with body image and issues relating to it. As you said, sir, in your experience in those past years, you said that you haven't seen much cases of problems relating to body image. And being born in the 70s, 80s, we all grew up as adolescents. We all, I believe, most of us have crossed this stage, and there was not much issues related because we were very carefree adolescents. We are mingling with the society. We faced school, family, peers. And personally speaking, like I had one issue in school that like the students used to tease me that I used to have a big nose and things like that. So these were all minor issues that we faced as students, but we have all overcome that with a positive image, and we have all gone into what we are today, very successful and with a positive and good self identity. But unfortunately, today's adolescents are in a constant virtual world, and media is a major influence. And that is why we see a lot of body image disorders nowadays. And we cannot deny the significant association of media and body image. Sir, can you share like what was your experience in those days? Have you seen adolescents with body image disorders?
There was not much of problem, just like you say that the big nose and you are looking little dark or you are not
Skin color.
wearing a good dress. That was used to be, but now it is not.
Yeah.
It was not much as today it is.
Exactly, sir. So that is what I wanted to highlight in this talk show. That is the influence of media, which has formed a very major influence on today's adolescents. Even the minor flaws, what they perceive themselves, has become huge problem for them.
Hmm.
So shall we move on, sir?
Yes. So my first query, rather not a question, is to inquire is why the body image is important issue in adolescent now.
So, sir, coming to adolescence or the teenage that we call, it ranges from age 10 to 19 years. So, this era or this period pertains to the developmental fifth stage of development, according to the famous psychologist Dr. Erik Erikson. So, he described various stages of a man's lifetime. So, this adolescent comes under the fifth stage, and he has named it as identity, role versus confusion, which means that the adolescents are in a constant search of identity about their role, and there is always a confusion prevailing in this period, which already it leads to so many changes, physical, mental, emotional, cognitive changes. And that is why body image is very important in this stage. And they're always in search of an identity. Who am I? Why am I here? What I am to do? What is my future? And questions. They're always in search of answers for all the questions. And there is one other famous psychologist, James Marcia, who determined four stages of identity formation in any person's individual, starting from identity diffusion, identity foreclosure, identity moratorium, and identity achievement. Every individual passes through all these four stages. As you can see from the figure here, the first two stages, there is low exploration and low commitment, which means that these adolescents, they always conform to the society and the family, and they always go with the flow, meaning they don't much explore what are the possibilities or how can I do this differently. But later on, when they reach the third and the fourth stage, the exploration is high, and finally they reach the stage of identity achievement, wherein they commit to something, a very a positive note or a very solid thing that I want to do this. So we can see that in these 4 stages, the body image issues are more common in the second and the third stages, wherein the exploration is also low and the commitment to do something or to try out something differently, out of the box thinking, all these are very low in the second and third stages. That is why they're more prone to disorders relating to formation of a positive self-image and thereby leading to thereby leading to body dysmorphic disorders.
So, what is the body image and its component then?
Okay, sir. So coming to body image, what it is actually? So body image by definition, it is the perception that a person has of their physical self, but more importantly, the thoughts and the feelings they experience as a result of that perception. For example, if I am standing in front of the mirror and the image, what I see is the perception, but the thoughts and the feelings I experience as a result of that perception or that image, what I see, is called body image. So, to put it simply, it is divided into 4 aspects. The first one is the way you see yourself, which is perceptual. And then the way you feel about the way you look, that is the affective component. The thoughts and the beliefs you feel about your body, which is the cognitive component, and the things you do in relation to the way you look, behavioral. For example, one fine morning, if I get up and stand in front of the mirror and I see a spot or a pimple on my face, so how I feel about that, the negativity that comes into me because of that small flaw, and what I do in relation to correct that flaw or that pimple. So immediately I go in search of an anti-acne cream or try to cover that flaw using some concealer. So this is the behavior. So as I said, the body image comprises of all these 4 components. It is not what actually you look in the mirror. It is more complex, which involves the thoughts, beliefs, and the behavior, what we exhibit in relation to the thoughts and feelings.
So, what is the spectrum body image and in adolescent?
Okay, sir. So in adolescence, there is a spectrum, like it can range anywhere from body dissatisfaction and it can also range up to body neutrality. In between, we can also have body positivity. So not one adolescent exhibits one trait completely. It is always a spectrum. They go through different stages. So maybe in the early stages, they may be dissatisfied, and finally they come to realize that okay, they come to terms with their body and image and then develop body positivity, or sometimes they even be exhibit body neutrality, which means that they are convinced that or they're content with what their body and what functions they do rather than the positive self image. So coming to body dissatisfaction, studies and research have proven that body dissatisfaction is very common, and it is especially more common in girls and women. For example, if we have a room of 10 girls or women, 9 of them have dissatisfaction in some form or the other, which means that 90% of them have body dissatisfaction in whatever minor degree. It could be a small thing. So they might see, my height is less, so I'm not as tall as she, or I don't have a fair skin as the other person. There is constant comparison. So studies have proven that there is 90% body dissatisfaction. But how much of this dissatisfaction actually becomes a body dysmorphic disorder has other factors which also influence. On the other hand, we have something called the body positivity, wherein the adolescents come in terms with their positive self-image and exhibit that positivity. Okay, I am good the way I look, and I am confident. I can do this, I can do that. This is the body positivity. And somewhere in the middle, we also have the body neutrality, meaning, as I said already, it is just accepting the body and the function it can perform rather than being anxious on the positive image that one has. So accepting the body as it is. So this spectrum, especially in adolescence, can range anywhere, or one individual can even pass through various stages. So initially he may be dissatisfied, then he can come to a neutral, and later when he grows up and becomes an adult, he can develop a positive body image.
That is exactly required. Actually. to
Yes,
think positively to come out of the body image.
yes,
So,
sir.
can you elaborate on the Looking Glass Self by Charles Cooley?
Okay, sir. So, this is one psychological, a very interesting psychological theory put forth by the famous psychologist Charles Cooley in the 1905, wherein he proposed that the identity of adolescents and also the self-image or the body image that they possess later is a result of what is called the looking glass self. So, as we can see in this picture, one adolescent boy, for example, he is seeing at himself at the way how in different forms. The first picture shows how my mom and dad see me. And the second picture shows how my girlfriend sees me. So he's portraying himself as being happy. And then how my older brother sees me. So the older brother, naturally, they try to control the younger one. So the sense of dominance prevails. And finally, you can see that picture which says how my ex-girlfriend sees me. So these are different images, what the adolescent perceives. Just to put it in simple words, the looking glass theory, looking glass self theory proposes that the identity or the body image that an adolescent possesses is based on how he thinks, like how the other people look at him or her, what they feel about him or her, and the conclusions based on those judgments, he develops an identity or a self image. So this is a very important theory because we need to know this, because dealing with adolescents, it could be parents, it could be teachers, it could be peer group, or it could be we pediatricians or adolescent health experts. We need to look at them and constantly appreciate them for all the good things, the way they look, which in itself helps a lot or influences them in creating a positive body image or even a good positive identity. So that is where this theory helps, because we can look at them and doing simple acts of appreciation. We always know as parents, we fail to acknowledge our children. So we always look in search of like academics, like marks. Even if he is participating in a sports, we ask him, if you have not got a first prize, why you came second or third. So we always looking for only the achievements, but we fail to acknowledge or appreciate the good things or the efforts they put in. So, this theory states that we need to always look at them in a positive way and keep appreciating them, acknowledging them, and this validation will help them in creating a good self identity and therein a positive self image.
So positive communication with the children is a main backbone of this to prevent the children from the body image.
Yes, sir, exactly.
Yeah. What is the body dysmorphic disorder? What are the symptom and sign?
Okay, sir. So we just had an introduction of what actually body image is and why it is an important part of adolescent development and why they are prone to problems in body image. So coming to the topic per se, which is body dysmorphic disorder, it is a mental health condition where a person spends a lot of time worrying about flaws in their appearance, and these flaws are often unnoticeable to others, meaning it could be a very minor flaw. It cannot be very easily noticeable, but this gives them a lot of anxiety, worry, and it causes a lot of obsessive thoughts in their mind, which leads to compulsive behaviors. So, if we can see the triad here, the first part, the obsessive thoughts, like the persistent fixation of flaw and intrusive thoughts dominate, difficulty redirecting the attention from the imperfection. And this leads to compulsive behaviors like repetitive checking of mirrors, excessive grooming rituals, and they even constantly take selfies. Nowadays, adolescents are constantly in like wanted to validation. They take selfies, they post in social media. So this constant taking of selfies and comparing with others is also a compulsive behavior, and seeking constant reassurance and engaging in frequent cosmetic procedures. They try to do various uh, knickknacks and so many things to look good and try different things on them. And finally, this obsessive thoughts and the compulsive behavior, how much it impacts the self esteem. and how much it impacts their daily life is what constitutes the body dysmorphic disorder. They impact on self-esteem, their feelings of shame and inadequacy and a low self-worth, and therefore there is an increased vulnerability to depression. So this is almost like a triad, which is almost similar to the cognitive triad of the famous psychologist Aaron Beck, which says that thoughts, feelings, and our behavior are all interrelated. So the obsessive thoughts leading to compulsive behavior, therein affecting the daily day-to-day life and activities is what constitutes body dysmorphic disorder. The common age of onset is, as we said, it is in the adolescent age because they are in the pursuit of identity formation. And as we already saw, there is a female to male preponderance, and it is listed in the DSM-5 category in one of the OCD. It's not classified under OCD, but it is a separate entity, but it has features almost similar to the obsessive compulsive disorder. And there are criteria fulfilling the BDD disorder. We are not going into the details for want of...
Definitely, we are not. So, what are the screening tools employed in to find out a teen has a body image problem in OPD practice?
Sure, sir. Before going into the screening tools, I would like just share some features, the symptoms and signs that what we can look for. So as
Yeah.
all of us are adolescent pediatricians, we always do this psychosocial interview using the HITS assessment scale. So we ask certain questions. So when we find that the child can have some issue of body image, we can ask these leading questions like, are you extremely preoccupied? I mean, some preoccupation with a perceived flaw which makes them look ugly or deformed, a belief that others take special notice of their appearance in a negative way. They always feel that someone is looking at them and making comments on them. That is how they feel. So that is what gives them the belief, the core belief that they look ugly. And they also engage in behaviors aimed at fixing, hiding the flaw with makeup, clothes, cosmetic surgery. Just to give an example, I had a 15-year-old, uh, I mean, girl brought by a mother and listing various complaints relating to anxiety. And the mother said one thing, that she constantly looks at the mirror and checks her hair. So initially, I was like taking history and all this. And when they left my clinic, and when I just saw them going out, and immediately after going out, this girl went to the two-wheeler in which they came, and in the mirror of the two-wheeler, she just checked and does this corrects her hair. So I just realized how much it would have been for the mother, because she's constantly watching that girl. And this activity of looking at the mirror and fixing the hair has become such an important thing. It's almost disrupting her daily activities, even her academics and studies. And so we need to be aware of all these symptoms when we feel that the adolescent can have a body image disorder. And they also have this habit of constantly comparing their appearance. And here I should always tell about media, because in all the social media, when they post pictures, they always compare themselves with others, and they have perfectionist tendencies, and they try to avoid social gatherings because they feel that when they go out and attend certain gatherings, the other people look at them in a negative way and they may comment on their appearance because they feel that, or they have that belief that they look ugly. And they also constantly seek reassurance from others on appearance. So these are some simple symptoms and signs that we can ask with the parents or the adolescent themselves when we suspect that they could be having a body image disorder. Now coming to the screening tools. Coming to the screening tools, the commonly used screening tool in BDD is called the BDD questionnaire. It has 4 major questions with various subsets. And there are also other screening tools like body dysmorphic disorder questionnaire, body image disturbance questionnaire, and there is also something called the body dissatisfaction questionnaire. All of these are available in the net in the PDF downloadable format. But we as pediatricians can use this simple tool, that is the BDD questionnaire, which has 4 major questions. The first one asking the adolescent, are you worried about how you look? If yes, what area of your face or body do you think about a lot? So this question will list various subsets like face, and the most common body parts that are associated with body image disorder is in the face, like eyes, nose, lips, ears, and in girls, the breasts are also an important body part which leads to problems. They feel that my breasts are small enough, they're big enough, and even thighs, abdomen. So these are certain body parts which are commonly associated with this BDD. And the third question, if yes, how many hours a day do you spend thinking about this problem? This question has subsets relating to the number of hours. For example, if you are thinking about that body part and if you checking the mirror, so how many hours a day do you do that? Like 5 to 10 hours, 10 to 20. So and the scoring is given according to the duration or the number of hours. And the fourth question, if yes, does how you look affect your work or social life? Like how severe is the problem that it's affecting your daily day-to-day life, going to school? A girl or a boy can even bunk school and be at home trying to fix or do some cosmetic procedures. So that in itself shows like how severe the symptoms are that their daily life is being disrupted. So it's a very simple questionnaire. We can use this as a screening tool, and it is only a screening. We cannot diagnose body dysmorphic disorder with this tool. If positive, we can refer to a psychiatrist for further course of treatment. So again, I reiterate the fact that this is only a screening tool.
So, what are the factors influencing the body image in adolescents?
Yes, sir. So this is one important slide that I would like to spend a few minutes on today. So from the start of this talk show, we discussed how media has influenced body image in today's adolescence. And that is why of the various factors, I have highlighted the media and social media in red. So coming to it later, the other factors, like the first thing is the biological factors. So we all know the adolescent, there are a lot of changes ranging from growth, physical changes like gain in height, weight, and puberty, and secondary sexual characters. So many changes happening during this time, secretion of hormones. All these are factors that influence the formation of a body image. And then we come to the peer influence. We know that adolescents are always with the peers and they tend to break away from the parents and spend more time at school with the peers, friends, and the social circles. So, what the peer or the friend feel about them. So, this is where the Charles Cooley's looking glass self theory comes into play. So, what others think of them, whether it's the family, the peers, is very important for them to form a positive body image. For example, if he just wants to have a funky haircut and his peer or friend says that it is looking very nice on you, that gives them that, okay, I do this. So that gives them that happiness and the validation that they are constantly in search of. And then psychological factors also play into role. Adolescents who already have a low self-esteem and not much of supporting factors, family disturbances. So these children are more prone for developing a negative body image. And as we already saw, family and school. The school environment is also very important because bullying is nowadays very common in schools, and a school environment which promotes bullying, it's also an important factor for a negative body image. And gender differences, as we saw already, girls are more common than boys to develop body dysmorphic disorder. So now coming to the most important influencing factor, which is the media and social media. This picture depicts the impact of the media and how we mitigate the impact. So on the left, if we can see the media and the effect of social media, the various platforms like Instagram, Snapchat, all of these platforms are built in such a way that they engage or even make the adolescents get addicted to it for constantly posting pictures, messages, and they also seek validation. So we know that when they post a picture and they get more likes, this is related or it is connected to the mesolimbic pathway, which is the addiction pathway. which is also related to other substance abuse. And nowadays, research prove that this social media or media addiction also follows the same mesolimbic pathway, leading to increased secretion of dopamine, and finally, it leads to addiction. So, media addiction or problematic internet use is a very important uh, problem these days with adolescents and media. So in media, if we see on the left side, the red part, the body dissatisfaction is more, leading to low self-esteem and decreased self-identity. And also there is increased cyberbullying and increased societal pressure. So all these create a very negative influence. So there is constant comparison and seeking of validation, all these leading to idealized body standards, which creates a lot of problem. So how do we mitigate this impact? So we need to improve policies and platform designs. So recently, in the past 4 5 years, we have seen many countries or nations bringing in the ban of social media for the younger adolescents, like even 13 16. Australia and many countries are following suit, bringing in the ban. And still the debate is going on whether a total ban is necessary or there should be a partial ban, but creating more awareness to the adolescents in the form of media literacy. So instead of a total ban, media literacy is what we need to teach the adolescents and to be safe in the social media. So these policies and platform designs have to be done, and there should be authenticity over perfection, and create a safe and inclusive media environments for these vulnerable children, adolescents. And there should be many body positivity campaigns and developed critical perspectives and boosting self-esteem and resilience programs like the various life skill education programs that we do for adolescents should also focus on creating a positive body image and build resilience and when they face bullying at school or outside. So this simple slide shows the effect on media and how we can mitigate this effect in preventing the problems related to body image.
So it is very important issue you have elaborated in one slide that shows your caliber of knowledge about the body image issue. Is BDD a cause for concern? Why it is important to identify and treat it?
Yes, sir, that is a very good question, sir. So, why do we even have to identify it? We say that many of them are dissatisfied with their bodies. So, many think that they have flaws. Why do we even need to identify and treat it? Because not every dissatisfaction will lead to body dysmorphic disorder, but we need to identify because body dysmorphic disorder is a major concern. And there are comorbidities like obsessive compulsive. We already saw that body dysmorphic itself is like an obsessive compulsive disorder involving repetitive behaviors and obsessive thoughts. And then it can lead to depression, persistent sadness and hopelessness caused by feelings of shame, frustration, and dissatisfaction. It can also lead to anxiety disorders, excessive worry or fear, and triggered by preoccupation with all these flaws. So, and it can also, in certain cases, lead to suicidal attempts. So, that is why we need to identify this early and refer them to psychiatrist and treat them if needed.
So is it a eating disorder also?
So this is a very common question, sir. Body dysmorphic and eating disorders, they have many things in common, but we also need to know what is the difference, because for making a proper diagnosis, because the treatment differs in both the situations. Though cognitive behavioral therapy is used in both the disorders, there are slight changes in the treatment. So now coming to the similarities and dissimilarities, coming to the emotions. So both the disorders have shame, disgust, anger, anxiety. But the dissimilarity is there is a high rate of suicide and depression in body dysmorphic because the insight is very low. And obsession is the defect in appearance is similar, whereas in body dysmorphic, it is specific body parts like it's my skin, it's my neck, it's my eyes. Whereas in eating disorder, the focus is more on the size and the weight problem. And coming to the behavior, as we said, mirror checking the mirror, taking selfies, reassurance seeking, camouflaging, which means using various filters to look. thinner or look or to hide those flaws. So these are all very common. But in eating disorder, restricting calories is very common. Binge eating and purging of the meals is very common in eating disorder. Coming to the cognitive part, there is a low insight and high ideation. In BDD, it's based more on appearance, whereas in eating disorder, it's based on weight. So actually, I have had a child, a 12-year-old with eating disorder. So she was more obsessed with her weight and eating that she used to have a small cup to measure the amount of rice that she eats every day during lunch. So actually, I asked the parent to bring the cup, and it's almost like this size. So this is
Oh,
the cup in which she eats rice daily. This is the cup that we actually use for eating vegetables. So she measures rice in that cup daily and eats only that. She had lost a lot of weight, and now I have referred her to a psychiatrist. She's under treatment. So I just wanted to share this because the obsession is more with the amount of what they eat and the weight, whereas in BDD, it's more about the specific body part. And coming
mhm.
to the neurobiology, studies have shown that there is an abnormal visual system processing in both the disorders, meaning there is a constricted view. So the visual system sees only one part, like it doesn't see the body as a whole. It sees only the part with that flaw. So the processing itself is different. And differences in BDD, there are reduced dopamine receptors, whereas in ED, it's normal or decreased. Personality traits, they're almost always introverted. They have low self esteem. They may be social anxiety, obsessive compulsiveness. Rejection sensitivity is very common. Even if someone says a small point about their appearance or something about their weight or anything, they feel very sensitive and react very overtly. And it will also lead to anxiety and neuroticism. Neuroticism is nothing but negative thoughts always dominating their mind about their appearance. Whereas in BDD, there is lower levels of agreeableness, which explains the increased rate of depression and suicide. Whereas in eating disorder, there is a level of agreeableness is better. So treatment in both parts, it is cognitive behavioral therapy and selective serotonin reuptake inhibitors are also used. In BDD, it's mainly exposure response therapy, whereas in ED, it is a very complicated, it goes through various stages. The first thing is the refeeding therapy and then behavioral family therapy and so on and so forth. So both are
So what is
almost
the
similar, but there are points to differentiate between them.
mhm. So what is the anticipatory guidance for pediatrician and families?
Yes, sir. So treatment, as we already saw, it's cognitive behavioral therapy, which modifies the intrusive thoughts and beliefs and elimination of the problematic behaviors. And medications are also used, which increases the level of insight and decreases the incidence of depression and anxiety. So coming to the anticipatory guidance, we as pediatricians, when we anticipate that an adolescent is having issues with body image, we need to teach them the body positive model. The 5 core competencies being reclaim the health. So making them feel that the physical appearance is not the only important part to being healthy. Practice intuitive healthcare, focusing on other strengths that they have, cultivating self-love and gratitude, having feeling gratitude for what they have and how they look, and declaring their own authentic beauty and community support is very important. And I also wanted to share this 6 important points in developing a positive body image. Body appreciation, body acceptance and love, whether you're fat or thin or fair or dark, accepting your body and loving your body is very important. And conceptualizing beauty broadly, not looking at certain parts. And beauty is at the eyes of the beholder, that's what we say. So conceptualizing it in a different way. And adaptive investment in body care, meaning focusing more on healthy body like exercising, proper nutrition, sleep. So concentrating on those things. Inner positivity, which is basically mindfulness, and protective filtering on information, meaning you don't look at media or videos that tell about beauty and things like that, fat shaming, body shaming. So avoiding those information from the media. So these are important things that we can teach the adolescents to develop a positive body image and good resilient skills.
So, what is the take-home message?
Yes, sir. So I just wanted to share like few experience and create an awareness for all the pediatricians and healthcare providers that there is a condition called body image or the body dysmorphic disorder. Though it is not very common, we need to have look into it and have an awareness that whenever an adolescent walks into a clinic, asking some questions about body image is very important, because certain issues, if they guide them and give them proper counseling, we can get them out of it early instead of it developing into a full blown body dysmorphic disorder.
So, thank you so much. Uh, a message from me to all the pediatrician and society is a body is a God gift, as early told. I said it is a body as you get a gift from somebody, you appreciate the gift. So why not to appreciate the gift given by the Almighty God to human being, and why there should be any question? Whatever you have received, you have been gifted, you should enjoy that body. Take care of your body in a positive way. You are lean, thin, or fat, it doesn't matter. But how you move in the society, how you behave in the society, what is your positive image in the society, that reflects your personality in the society rather than the body which you have received from the God. Thank you so much, Lakshmi ji, and we are proud to have you here in the talk show. I am sure that all the pediatrician of Indian Academy of Pediatrics, other pediatrician, society will enjoy it, listening to her and updating themselves about the body image issue. And if there are any question, any queries with them, then can directly talk to her or write in comments in YouTube, so that she can answer from YouTube to you. Thank you so much.
Thank you for having me in the show, sir. It's my privilege. Thank you so much, sir. Very happy to be part of the show.
Thank you very much.
Thank you,
Thank you
sir.
very much.
Thank you.